All right, perfect. So our pre-submitted questions, you get 1 minute each. The first one is, currently a lack of disability data impacts the ability to remove barriers for an equitable quality of life for those living with a disability. How would you work to ensure a disability identifier question is added to all city surveys, applications, and other forms where other optional demographic questions like race, ethnicity, age, gender, sexuality, and income are collected?
My appointee to the city's Disability Access Advisory Committee, Ms. Melanie Cawthon, successfully advocated for this addition to the application process for people interested in serving on boards and commissions. So that information is now being collected thanks to her advocacy, and I'm very proud to say she's my resident and my appointee. As part of the city's work on equity, we can advocate for the inclusion and collection of this information in our city surveys. And lastly, I am chair of the city's committee, City Council Committee on Community Health and Equity. So I can bring this item forward for discussion at my committee and for us to make recommendations for adoption by the full City Council. Thank you.
Perfect, thank you so much. The next question is, how do you see your district office working better with our disability community on the state level?
The City of San Antonio develops a legislative agenda every year for the federal level and every 2 years for the state level. As that legislative agenda is being developed, I think it would be important for me to meet with disability advocacy organizations to prioritize issues that can be addressed at the state level. I would then submit this as either a memo or during a city council meeting when the legislative agenda is being discussed. I would also be very happy to, and I think it would be just as effective, to convene a meeting between leaders in the disability access community and city staff that works directly on the legislative agenda, as well as the chair of the Intergovernmental Relations Committee, who really drives the legislative agenda for the city of San Antonio.
Thank you. Next, we're going to be moving on to some questions in different categories that were predetermined through our Partners in the Disability Vote, which is a collection of different disability advocacy organizations and self-advocates that came together to kind of prioritize the best questions to ask. So our first question in that category is under equity, representation, and creating access. And it is, what do you see as the pros and cons to emphasizing the disability lens alongside the racial and poverty lenses when examining and implementing equity measures and initiatives in San Antonio? You have a minute.
I think at the end of the day, it will help us design better policies and programs, not just for the disability community, but for everybody. I think with our Office of Equity, we have an easy, or maybe not a slam dunk easy way to do it, but we have the infrastructure there to make this happen. Thank you.
Thank you. The next question is, what steps will you take to create access for people with disabilities to share information about their needs and concerns with you and your office?
I currently have a forum I call Coffee with Anna. Currently it's called Zoom with Anna. It is available every month, sometimes twice a month, to meet with individuals who live and represent those in District 7. We can schedule a meeting for that time, and it's a meeting directly with me, not just with my staff. That is available to all District 7 residents. I think I would also seek the assistance of the disability leaders in our community to communicate that to residents in District 7 as well. Thank you.
The next question is, in the past, there have been numerous barriers preventing individuals with disabilities from actively participating in the elections process within Bexar County. Do you see any opportunities where, if elected, you could positively influence best practices for inclusion and accommodation in the election processes within Bexar County, especially when it comes to city elections?
Absolutely. In fact, I did raise this issue. My precinct polling location was not accessible, and that has been modified. Now that it is at the same school, but in a different room at that school in order to be more accommodating. So I would take input from disability community leaders who are aware of these barriers and bring them forward to our city clerk. She is the direct liaison with Bexar County elections. We could also find ways to ensure that that is part of our contract with Bexar County elections, because whenever we host elections, we contract with the county elections department to do that. Thank you.
Perfect. And then the last question in this category is, soon disability will be an optional demographic question on the city clerk's application for city boards, commissions, and committees. How will you go about using this information to ensure that people with disabilities are equally represented in this part of the governing process for San Antonio?
Thank you. I think we need to think about more than equally represented. It really depends on the board or commission. Sometimes we may wish to have a lot more representatives from the disability community than what is in the general population. I normally, when I do appoint people, I do look at my demographic composition already on boards and commissions, and then I look at the demographic composition of that particular board or commission. I also think about the purpose and mission of that particular board or commission and try to tailor the appointee to best bring what I think is missing, but also to bring what I think District 7 needs to that. Another way is right now we are in the process of revisiting additional appointments to the Economic and Workforce Development Advisory Committee, actually the Ready to Work Advisory Committee that was recently formed. We are evaluating adding 2 additional people, and I'm very interested in ensuring that one of those people is representative of the disability community.
Perfect, thank you. Before we move on to the next category, if anyone has any questions, feel free to put them in the chat, or you can unmute yourself and ask. No, looks like we're all good. All right, the next category is transportation. The question is, currently Via Paratransit services cover only those living within 3/4 of a mile of a traditional bus line, and ride-sharing options are not accessible. What legislation, policy, or use of city resources would you champion to influence the expansion of accessible, affordable, and efficient transportation options for those living with disabilities outside of the mandated Via Trans service areas?
Okay. Actually, I want to mention that my first job in San Antonio was at Via, and my first project when I was at Via was to evaluate our Via Trans service and compare the use here in San Antonio to the use in other major cities in Texas. At that time, what we found was that we had a much higher per capita usage of Via Trans rides here in San Antonio compared to the other major transit providers or operators in the state. And I still think that's a fascinating challenge that we have here in San Antonio. And I think that in addition to meeting the immediate demand, right, or the immediate need of getting a person from point A to point B, I think it also begs the question about broader issues like, why are we so dependent on it? Or do we not have enough sidewalks? Is it too unsafe to move? Or some of this may also have to do with, why do we have so many mobility impairments in San Antonio, right? A lot of diabetes, uncontrolled diabetes, and above the knee amputations and such. So anyway, much bigger conversation. But as someone who did work at Via, I do know how strapped for cash they are compared to the other major providers. We currently only receive a 1/2 cent sales tax and a little bit more from the ATD. And that was a huge mistake that was made when VIA was incorporated in 1974, I believe it was. Fortunately, it looks like we will be opening that possibility, opening up to more possibilities, because number one, the voters just approved an additional sales tax to go to VIA beginning in 4 years from now. I was supportive of that. I was also supportive of providing more money to VIA on an annual budget basis. So that's going to continue between now and the 4 years from now. I've also been supportive of returning that ATD funding, the Advanced Transportation District funding, back to VIA. In fact, that's another project I worked on when I was at VIA. And I have to tell you, I was very torn about the fact that it was VIA's money. Some of it was going to go to VIA, some of it was going to go to the city, and some of it was going to go to the state or the county, because I know that when you make it easier to drive for people, it's great for people to drive, but it's also harder for those people who don't drive to get where they're going. So I think as long as VIA has funding, that's a policy decision that they would be able to make.
Thank you. Our next category is employment. Before we move to employment, was anyone in here wanting to ask any questions? You can feel free to put it in the chat and I can read it out loud, or you can unmute yourself. Had a few more people join us. No? Okay. Our next category is employment. And the first question is, what do you see as the major factor or factors preventing members of the disability community from achieving economic resiliency? And what actions, if any, would you take to improve economic outcomes for members of the disability community?
There are two ways I think we can approach this. One of them has to do with the type of jobs people have, and the other one has to do with the type of jobs people have or what benefits are offered in that job. So I think the city's approach toward economic resiliency for everybody, right, has been this Ready to Work program that helps to migrate people from an hourly job that you may be more like, that you're more vulnerable in terms of being let go or being susceptible to a recession, and in terms of not being able to work from home, right? So migrating people from jobs like that to jobs where they can work from home, where they are less likely to be furloughed or let go in a recession, and where also the income levels are higher. And I believe the disability community should be just as included in that process as any other resident in San Antonio, right? That should be accessible to them. So number one, we want to make sure that the program works for people in the disability community, and that the wraparound services that it's going to offer the participants also works for members of the disability community. And that may be why, or that's also why it's important to have a representative from the disability community on that advisory board. Number two, let's go to the fact that this program is not going to be big enough for everyone that could use it. It may also not work for everyone. But at the end of the day, I believe we will still have jobs that are in restaurants, that are in factories or assembly lines, or just not your salaried jobs. And those are dignified jobs, whether you're working at the Alamo, whether you're working across the street at the Menger Hotel, or at our convention center. Those are dignified jobs that we need in San Antonio. That is part of our identity, right? The Riverwalk downtown, the convention center. So we have a responsibility as community leaders to ensure that those jobs do right by the people that have them, because we will always have people in those jobs. And what do I mean by do right? I mean, we need to encourage all of those businesses, because we can't mandate it. We need to encourage all of those businesses to find a way to provide paid sick leave. I've advocated for that at the city. We have a technical assistance program set up in order to do that. It's safe and sick leave to do that. That is one way. And another way is interacting with the unions that serve those areas, which I do as well. I've received the AFL-CIO endorsement, and I think just remembering that those are real jobs and real people. Thank you.
Thank you. The next question is, will there be additional funding for the City of San Antonio to offer more services, such as addressing training and competency of mental health care providers in order to accommodate individuals with a variety of disabilities in their programs?
I think it depends what priorities we set. We will be developing next year's budget. We'll start that in the summer. We could do this either directly through the City of San Antonio. That's one option. Another option is to fund an organization that does it through what we call our delegate agency funding process. I think I'm not familiar with the city having done this before, so I'd be very interested in discussing how this would work with a member of your community, because that would make me a stronger advocate for it in the budget process.
Thank you. The next question is, there are more and more people with intellectual and developmental disabilities, IDD, in jail as a result of lack of funding and services to handle mental health issues, issues of childhood trauma, behavioral issues, and a wide array of special needs. Many individuals are deemed, quote unquote, incompetent to stand trial as a result of their disability, and this keeps them trapped in the legal system indefinitely until they can prove competence, which will be difficult for someone with developmental delays. There are also a variety of special circumstances that arise for those who have communication barriers due to their disability. As the city works to evaluate the role of policing in our community, what recommendations would you make to ensure people with disabilities are getting the appropriate level of care, support, and reform at the point of entry into the criminal justice system?
Thank you for that question and for that information. The committee that I chair on community health and equity just recently had convened a meeting precisely to discuss mental health and policing and how we address that and how we can improve that. So this was on the 22nd. So we are going to put forward, after hearing from the speakers that we had, our committee is going to put forward a set of recommendations about that. We did not have a speaker that addressed intellectual disabilities. So I would be very interested in having myself or someone on my staff speak with someone who's more familiar with this so that we can integrate that into our recommendations. Those recommendations are going to move forward into consideration by full council and then into our budget process. So the good news is we have a process lined up where we can just fit that right in. The bad news is that we're not already doing it, right? But looking forward to collaborating on that.
Thank you. The next question is, what specific action do you think the city could take to improve hiring opportunities for persons with disabilities?
Do you mean hiring into city jobs or within the city of San Antonio?
I think it just means in the city of San Antonio, generally.
Great. So we could do this as a pilot program with several partner organizations. We've done this with other types of specialized hiring that we want to do. So for instance, we had a pilot program or a small program for military wives or military spouses, let's say, who are here in San Antonio. We have a program that is being developed regarding second chance hiring. So I don't see why we wouldn't be able to do something along the lines of this. So, putting people into a registry or having job fairs, connecting them with jobs.
Thank you. The next category is the digital divide. We've seen how access to technology has been more significant than ever due to the COVID-19 pandemic and everything going virtual. So keeping that in mind, the first question is, what experiences do you have with accessible technology?
Sorry, could you explain that in a little more detail?
The question just says, what experiences do you have with accessible technology? I think it's probably talking specifically about making websites screen reader accessible, just accessibility digitally, especially when it comes to web resources and all things digital, which has been our whole year.
Right. Okay. So accessible not just to people, but to the disabled community. So I have actually little experience. My focus has been during this pandemic is ensuring that we got information out in multiple languages. I mean, I can tell you a little bit about that. The city has been using Google Translate as a default on a lot of our city websites, and that really can lead to a lot of confusion. And in the case of a worldwide pandemic where people's health and lives are at risk, that's simply not good enough. And we need to ensure that people have access to information. When it comes to making sure that information is available in a more accessible format, the city has invested in ASL interpretations for all of our communications. Now, in terms of like press conferences, but in terms of making sure that our website is totally accessible, I will tell you, I have not inquired about that, but this is a great suggestion, and I'm happy to take forward any of these suggestions if they come from this group or from the advisory committee that meets monthly.
Perfect, thank you. The next question under the digital divide is, how would you implement software training such as that offered by Senior Planet to people living with disabilities?
Oh, I think that's a great idea. I think we could pursue a partnership with Senior Planet to have something tailored for people with disabilities. And since they already have the infrastructure set up for the training, and communicate that to our broader community and the disability community, and begin to set that up. I think it would take an investment upfront, and I think it would absolutely be worthwhile to ensure that members of the disability community are connected to city services and to basically the outside world, right? Everything is, so many opportunities are online.
Perfect, thank you. The next category is education. Before we get to that, I just want to make sure if anybody has any questions, go ahead and put them in the chat. Lacey, are you doing good? Do you need a break? You're good? Okay, perfect. Thank you. Perfect. So education, the first question is, what steps, if any, would you take to assist families caring for students in special education programs during the pandemic who have found their students without necessary aids and services and are regressing in their development?
Oh, wow, that's terrible news. I believe that I would be happy to assist any family in advocating directly to their school, their elected school board member. I think, and I've come across this, not that particular issue, but when it comes to advocacy at the school board level, a lot of our parents don't really know that they have that power, right? That they do elect that leader, and that leader is accountable to them. So I'm happy to broker the meeting or bring them together, but that is something that the school board leaders do need to be aware of and to address.
Thank you. The next category is healthcare, and we also have just one question under healthcare. And it is, when vaccines begin to arrive in regular intervals, what will you do to ensure individuals living with disabilities in our community have equitable access and reasonable opportunity for receiving the vaccines? So I know they are already arriving in reasonable intervals. So if you want to speak to what you're already doing as well.
I'm doing this now. So this one's very exciting for me. So tomorrow, City Council will discuss the creation of a vaccine registry / waitlist. And I have pushed very hard for this, and there's been, it's been slow in coming around, but we're finally there. Folks are on board. The major vaccine providers are willing to participate. The city of San Antonio the staff is embracing this proposal, and many council members have been asking for this because we hear this from our community. But what's going to be brilliant about this is that it's going to be different from the wait lists we've seen in other cities. So maybe we were the last ones at the party, but we're going to be the best ones at the party if this all works out, okay? If this all works out. So what is unique about our system is that it will collect information from people who want to receive the vaccine, including information such as, your age, and we can add to it whether someone has a mobility or other type of impairment. We can add that as part of the information that we take in. Then what would happen is that if I am the Alamodome and I'm providing vaccines, I can say, you know what, today I'm only going to focus on people with mobility impairments. I have, 1,000 vaccines to distribute today. Let me go into that list and I'm going to pull out from that list the people who have mobility impairment. So in this way, we can prioritize or target vulnerable populations, and it will be up to each vaccine provider, whether it's the University Health System or UT Health or the City of San Antonio, to choose which target populations they will serve. Because the truth is, if we want everyone vaccinated, we do have to work together and coordinate to make that happen.
Yeah, thank you. The next section is socialization and arts and culture. And the question is, what can be done, if anything, to make our community truly accessible?
Universal design principles that would need to be adopted. And in fact, right now, not quite right now, but in the next few months, the city will be updating what is called our Unified Development Code. That is basically the code that says how tall your fence can be, how wide a sidewalk should be, what our inspectors are going to review when they go to a building that's just been built and has a permit. I think it would be great if we had the Disability Access Advisory Committee contribute to the review of the Unified Development Code and make specific recommendations for it. I could get into the weeds about the process for the changes, but what I'm saying is that there is an opportunity for this type of change to be considered. And whether, change doesn't always happen easy when it comes to the development code, but we can definitely make some strides in this update. In addition to participating in that process, I would encourage the members of the disability community to meet with council members to explain which of those code changes are the most critical and impactful that they would like to see.
Thank you. The next question is, do you think something more should have been done to educate the community about the ADA accommodations for wearing masks, as well as the communication barriers that masks cause for a number of individuals with disabilities in our community? If yes, what will you do differently during the next emergency response to ensure people with disabilities aren't inadvertently harmed?
So at this point in time, I'm on a committee called Committee for Emergency Preparedness. It is a combination of council members and citizens here in San Antonio. And while our focus is reviewing the storm, the winter storm, our findings and our recommendations are going to be universally applicable to other emergencies here in San Antonio. So I think this is a great point to integrate into how do we move forward and how do we address an emergency when it comes up again? What's that checklist that we need to go through and ensure that the things you just said are part of that checklist?
Thank you. And then the last question in this category is, are there events specific to the disability community that highlight the resources available to them in your district? If so, what are these events, and do you have plans to add more? If not, do you have plans to add some?
We haven't had any specifically hosted by our office. I could tell you that's because of COVID, but the truth is, even before COVID, we actually hadn't done that. And I think that's a wonderful idea. I would be happy to partner with a disability organization who can really advise us, or with Melanie, right, who can advise us on what type of events would be most helpful and useful. And our team will do the work on gathering what those resources are and making sure that the event is successful for people. Thank you.
Thank you. Our next category is public safety. And the first question is, how do you plan to interject considerations of residents living with physical, intellectual, sensory, or mental health disabilities, which need to be addressed as the city works to negotiate updated policies and practices around policing in our community?
I think this is something that we can meet with the Disability Access Advisory Committee about to get some specific recommendations and bring those forward to the Public Safety Committee. I know I sound like I'm giving you a lot of jargon, but I'm really telling you ABC. This is how we how we get it done. Is we get formal recommendations from a body which is already there. And then we send those to another formal body, and that can hopefully be integrated into what the police do on a day-to-day basis, whether it's our training or our in-service training of cadets or in-service training of officers. I mean, you can also go and talk to the police chief. That's one option, but I'm not a part. I don't serve in that route, so this is the route that I can assist with.
Thank you. This is not a question on the list, just a question from me. I've been listening in on the Disability Advisory Access Committee meetings every month, and I know that they had talked about working to improve accessibility for EMTs, maybe with having interpreters via telehealth or using technology to help EMTs reach people with disabilities or people who are deaf. Do you have anything to say about that, or any ideas on how we can improve accessibility of emergency services?
Ooh, yeah, I think that suggestion is great. I also think we should incentivize and provide additional pay for any EMTs who are able to communicate via sign language, and we should do the same thing for for other languages as well, like Spanish, because even though you can use a technology, the truth is, in an emergency, sometimes that's, or even day to day, right? Like it's a little awkward still. It's not natural for us. Like we're just barely getting used to Zoom. So can you imagine, like, if you're in a crisis and you're afraid you're about to die, it would be very hard, I think, to focus on a device. It is absolutely better than nothing, but I think the gold standard would be someone who can communicate with you. So someone who's there, who you can look into their eyes, right, and connect with them. So I would encourage the additional pay for them, but another option is, if we're able to justify it financially, would it be worth it to bring an in-person interpreter? I don't know about the financial feasibility of it, but I think it should at least be, the question should be asked.
Thank you. The next question in public safety is, according to the San Antonio Code of Ordinance, Section 2911, it is the duty of any property owner to maintain the sidewalks, parkway, curb, and driveway abutting said property in a good and safe condition, free from any defects and hazards. How would you address the challenges of building and repairing sidewalks to improve the walkability and accessibility of our city for those who depend on pedestrian modalities?
Pedestrian accessibility, or what I call transportation equity, has always been a priority for me since I worked at VIA. The city pays, and we put our tax dollars in to provide infrastructure for vehicles. Feet are just as important as those vehicle, or wheels are just as, non-motorized wheels are just as important as those vehicles. So the code that you read out doesn't really make sense, and we don't enforce it. I will say that. In terms of ensuring that we have a sidewalk infrastructure, I recently advocated at the federal level for additional funding for sidewalk infrastructure. I serve on a national committee on transportation and infrastructure, and we were able to speak to the new Secretary of Transportation and share priorities for our communities. And that one was mine. That I shared for the community of San Antonio. And the truth is, if we wanted to fill in all the sidewalks that we have right now, it would, all the sidewalk gaps, in other words, the missing sidewalks where we don't have sidewalks, it would take $1 billion. That's the whole entirety plus of our next bond or our last bond cycle for the city of San Antonio. And that doesn't even count the ones that need to be repaired. That's just the ones that haven't been built. So in truth, what we're doing right now, where we're budgeting X amount year by year to do this, I'm not gonna be alive by the time we filled all the sidewalk gaps. So we need to look at new revenue sources. Something I would like for us to consider is possibly directing parking funding that we collect. A certain amount of that would go into a sidewalk building fund or a sidewalk maintenance fund. That's one approach. I think we could look at some others.
Thank you. The next question is, what steps will you take to ensure additional services are provided when someone with disabilities is arrested, to include mental health one-to-one support, advocate assignments, and ongoing communication with the family or guardians?
So this is one of those things that I think we can put into our checklists for procedures that our officers are subject to when they do arrest people. Like you could add this right before or right after reading someone their Miranda rights. I think at our facility that we use to detain people, we do have a health screening when people come in to ensure that somebody isn't dependent on a certain medication that they need at that point, and if they are, we want to make sure their health isn't impaired while they're there. So this could be part of that health screening. It's a partnership with I believe it's UHS. In terms of ongoing communication with the family, I think we can do that so long as they're in custody with the city of San Antonio. I would say we also would need to talk to Sheriff Salazar, because ultimately those individuals that are arrested to get transferred to the Bexar County Jail.
Thank you. The last question in this category is, how would you prioritize funding for complete streets, including bike lanes and fully accessible sidewalks?
I would say that's really important. Sidewalks are really important right now. So usually what we get is city staff will say, okay, well, this is your streets pot, this is your sidewalks pot, and this is your, whatever else pot. So I would also look for ways to move money between pots or additional pots to do that. We have an additional funding source called Neighborhood Access and Mobility Program. We have used that for pedestrian accessibility. People come to us with very specific asks that we might not have noticed. So for instance, there was a woman who is visually impaired who would walk to the CVS. This was in the northwest part of the district, who would walk to the CVS to pick up her prescriptions. And sorry, I have a tickle. Excuse me. Excuse me.
Bless you.
Thank you. And the intersection, which was a big intersection, did not had a pedestrian signal with the lights, but it didn't have the audio attached to it. So we used our NAMP funds to ensure that she could hear it when she went to that. We also installed a sidewalk. So that code that you read, that it's up to the property owners to install the sidewalks. So where you have undeveloped land, sometimes there aren't sidewalks because the owner hasn't come in to do it. But that might be a critical connector for some people, that whether they're in a wheelchair or walking, that could save them 20 minutes on their journey if they're not going to get on the street. So we also use NAMP to fill those particular types of sidewalk needs.
Thank you. We have one last question in the Partners in the Disability Vote questions. The category is other, and it is, what types of sensitivity training do you think community-facing employees and officials should have around the topic of disability?
I think we want to be able to serve all of our residents well, and that includes the disability community. So in particular, I think those city positions that are public facing are the highest priority for training. After that, it would be, I guess, everybody else, because we all work on projects that affect the people of San Antonio. And I think we want to keep people with disabilities in mind as we are designing for residents of San Antonio. In terms of what the training would consist of, I would certainly defer to the experts on that. But I do think it would be of tremendous value, not just to the disability community, but to everybody.
Thank you. Before we move on to the next section, Lacey, would you like to take a break for a second, or? No, you good? All right.
I'll take a break for a second.
I know, it's like if anybody needs to grab water.
Yeah, thank you.
I'm drinking that same drink, just in a cup. Jonathan, I saw you unmute. Did you want to ask a question in a little bit when we get back? You can type it in the chat too if you're more comfortable. Hi, thank you for joining us. We're just taking a quick water break.
Thank you.
Yes, of course, thank you. All right, so the last section of questions were pre-submitted by attendees, not necessarily in our district, but just in general. The first question is from someone in District 1, and wait, we already did this one. Hang on, sorry. Okay, perfect. Someone in District 1, the question is, how is a disabled child supposed to have accommodations made to his government-funded home now that he's in a larger wheelchair? Please tell us about the initiatives, programs, and policies you would initiate to ensure low-income families have access to resources that support accommodation renovations to government supplemented housing, if any.
So in terms of government supplemented housing that the city is involved with, we do participate in the TDHCA program, which is a tax credit program operated by the state with federal dollars. We also manage and run an organization called the PFC, the Public Finance Corporation, and it is meant to finance housing and make it more affordable. If this is the type of accommodation that the individual is referring to, I think it's critical for us to going forward, or if we could even going back, but certainly going forward, to look at the demands or the requests that we make of the organizations that we finance through the PFC. The TDHCA portion is a little bit more difficult. What we can do is ask about that, their plans and their programs. So for instance, I'll be a little bit more concrete about this. So if a developer wants to build, a 200 housing unit complex, what they do is let us know about it, and then we decide whether or not we're going to make that recommendation to the state, saying that yes, we endorse this project. Before we make that recommendation to the state, there is a questionnaire that they have, or an application that they have to fill out. So we could add something like this in the questionnaire is, we could even add how many accessible dwelling units are there. And we could say, what is your plan for accommodations as a resident or a family's accessibility needs change? How would you accommodate those, or how would your property management company accommodate those? So we could do that on the TDHCA side, and then we can make that a requirement on the PFC side. Now, I don't sit on the PFC board, but ultimately the programs that they approve are blessed by the full city council before they can get funding. So that is a way to integrate that assurance.
Thank you. The next question is from a District 2 voter. It says, how do you see yourself being a role model for kids and adults with disabilities, especially as they're looking for work and trying to build trust in adults? Tell us a little bit about how you see yourself as a role model and leader who is paving the way towards independence for youth and adults with disabilities in the San Antonio community.
I think one of my favorite examples of adults who have had a challenge with a disability, maybe had a terrible accident and had to adapt to a whole other way of life, and are showing that independence is a resident in District 7 by the name of Chris Salas. After his motorcycle accident, he founded a nonprofit specifically for people with disabilities so that they could be active. And so he's taken them, boogie boarding or doing things that you might not imagine yourself doing as someone with a disability. I think because I'm someone that doesn't have a disability, perhaps the best thing I can do is support people who do. So being visible with people like Chris, participating in some of his events, I would hope that is an encouragement to children with a disability.
Thank you. The next question is from a District 2 voter. It says, what is being done to educate the disabled population about voting? We'd like you to share where you see opportunities for partnering with the county to work toward increased voter turnout from the disability community.
Okay, so the truth is a lot of people in the city of San Antonio don't even know we're having an election on May 1. The turnout for the city is, if we're lucky, 20% in some parts. And that's just people who are registered, from people who are registered to vote, right? It doesn't include the people who are not registered to vote. So it would be an even smaller percentage. So in addition to informing the disability community, we need to inform all of San Antonio. Currently, neither the city nor the county have a dedicated fund or a dedicated program to educate registered voters when an election is coming up. There is no voter guide that is mailed to anybody's house. There is no postcard. There is no robocall. There is perhaps some information on a website if you happen to go visit it, but there is no budget for promoting this on air. if we wanted to buy advertising for it. And there is no budget to send someone to do a media blitz and announce that we're having elections. So what I just gave you is a host of ideas and ways in which we could educate the public. My colleagues and city staff have been very hesitant and a little bit tentative about getting involved in that, mostly city staff, I believe, because it may look like they're advocating for a specific candidate or cause. So what I've discussed with some of my colleagues is farming that out or contracting that out to a third party to do, so that we provide the funds, but it is directed in another way, so that it at least gives us one level of separation. But I think we have to acknowledge that allowing people to participate and encouraging them and helping them participate in the democratic process is how we ensure that our work is representative of the people that we serve. So it is our obligation to do that. And I think we have to stop being scared of it.
Yeah, I know. It's like, I think Texas is 51st in voter turnout, right? In the whole country. Like, we're behind Puerto Rico. So I'm pretty sure that was the last, like, the Texas on the Brink study. I think 2018, we were 51st. So hopefully we get that going soon. The next question is from a District 5 resident. It says, what can we do to ensure that there are healthier food choices in our stores and restaurants? And can we open restaurants with better choices? The obesity rate here in the West Side is high. So we'd like you to share what policies, programs, or incentives you put forward to ensure encouraging healthy food and eliminating food deserts and food swamps.
Sure, great question. I think nutrition is a core driver for some of the really poor health outcomes that we have in the city of San Antonio or in the county. As you may be aware, we have health inequities on the order of 20 years of life expectancy. So in the richest neighborhoods in the county, people can live up to 20 years longer than people who are in the poorest neighborhoods in our county. And that's the scale of a generation and someone not being able to live to see their grandchild. And there is no one single solution, but nutrition is definitely part of that. It also contributes to the mobility impairments we talked about earlier. One program that the city has that I'm proud to say we expanded last year is called the Healthy Corner Store program. What it does is it finds a corner store in a food desert, and it subsidizes the cost of fresh fruits and vegetables. In fact, I lived in a food desert up until the Healthy Corner Store program came to my neighborhood. So now that store is just a few blocks away. This is one program. Another way is we do have a program called the Healthy Neighborhood Program. I'm also proud to say that we increased the budget for that dramatically this past year by adding $500,000 to it of local city funding. So not federal, not grant funding, but it's like our tax dollars. So that will continue. And that program comes up with tailored solutions to each neighborhood. So possibly working with the inner West Side, having the community health worker in that area work with grocery stores in the inner West Side to see what healthy food we could bring. Now, in terms of restaurants, I do think there are other things we can consider, like some level of additional incentive for healthy food being provided. There are parts of town where there's not, right, a restaurant where you can get healthy food. There are purely like drive-through kind of restaurants. So I think it's worth having a group look at that and come up with some recommendations about how we can incentivize that.
Perfect. Well, thank you so much. I know you have to get going. So is there anything else you'd like to expand on or take a minute to say anything else before we log off?
First of all, I'd like to say thank you very much for hosting this forum and congratulations for hosting it. I'm really impressed at the thoroughness of the program and of the questions and of the quality of the moderators that we have here tonight, and that you were able to have the interpreters as well. Secondly, we talked about a lot of things tonight. So I think in order to actually move forward on policy, it would be wonderful to speak to some leaders of the organization and find out which are your priorities, because I think that the world is our oyster, right? As far as all the things we can do to improve life for people with disabilities in San Antonio, there's definitely a lot of room for improvement. But if you wanted to see one thing happen sooner rather than later, like if you could only have one thing, right, what would that be so that we could get our energy behind it? So I'd really be interested in having that conversation too in the future.
Well, thank you so much for being here. Thank you, Lacey, for interpreting, and thanks to all of our audience members. We'd also like to thank our ASL sponsors, which are RevUp Texas and Deaf Interpreter Services Incorporated, and some of the candidates who aren't able to be publicly recognized for sponsoring ASL, but they still chose to support it. So thank you for supporting accessibility and for acknowledging the importance of including the deaf community. And thank you, Anna, for being here.
Thank you, Natalia. Great work.
Thank you. Bye. Have a good night. She had to go return a call to the mayor. So we are all done for this breakout room. Thank you guys so much.